I am thrilled to have an interview with Dr. Malhotra, who's a hematologist and oncologist. And I'll let him explain what that means in a little more detail. But we're going to talk about women who bleed from fibroids and what that leads to, which is blood loss and anemia, and how we can go about fixing some of these things. Dr. Malhotra, just a brief introduction, he did his medical school at the D.Y. Patil University in India, and then he went on to do his residency in internal medicine in upstate New York, and then a fellowship in hematology and oncology at the University of Cincinnati. And he is practicing here in the Bay Area. And so thank you so much for being here, and I would love for you to tell our listeners what you do on a daily basis.
Hi, Cheruba. It's a pleasure to be here. So I treat blood disorders and cancers, and I work at the UCSF John Muir Berkeley Outpatient Center, which is a joint effort to bring care to the community in Berkeley. I treat patients with anemia all the time, and it's great that you're doing this to educate our patients and the community about this so they can identify their symptoms and come to their doctor, present to their doctor with what they have, and be educated about it.
Can you tell us a little bit in kind of simple terms what that term means? What is anemia?
Yeah, so anemia in simple terms means that you lack enough healthy red blood cells to carry adequate oxygen to your body's tissues. So, and that can have various effects on your body. And you start feeling very tired, you start feeling fatigued, lack of energy, headaches. Sometimes you feel like your heart is racing or you have a pounding in your ears. Most of the time when there's iron deficiency, you can have a craving to eat ice. That's a kind of a weird symptom that a lot of patients have.
Anything else that you would say, like, okay, you need to go to the ER if this is happening to you?
Yeah, I'd say that situation happens, unfortunately, once in a while, where a patient is having symptoms like chest pain or severe shortness of breath, even with minimal exertion. And that's when we usually recommend that they go to the ER and get a blood transfusion as soon as possible. Or if someone is continuing to actively bleed heavily and already having a lot of symptoms, like you said, dizziness and things like that, and continuously bleeding, then we want to replenish their red blood cells as soon as possible because they're not getting enough oxygen to their brain and their heart.
I just want to remind everybody, Dr. Malhotra and I are both physicians, but we are not your physician. So this information is, really for education and information. We'd love for you to learn from this. And if you're truly anemic, if you have fibroids, please see your gynecologist or your hematologist. And I hope you found this useful, and we'll see you on the next episode of the Fibroid Doc. Thank you so much. Bye, everybody.
Thank you.
Bye.